أحلى.
المشتركة اللي معنا هالأسبوع اسمها أمل من سوريا. أمل كانت عم تقطع بظروف كتير صعبة وكانت أمنيتها أنها تشترك بالبرنامج.
So what we are going to do for this patient is we will start with the breast augmentation. She doesn't want it too big, but she wants to have some cleavage, and this is what we said that we were going to do for her. We're going to put 2 different size implants because her breasts are different. It's the most recent type of implant that should give her a very natural look, and we're going to do it in the simplest possible way, which is through an incision under the breast, 5 centimeter incision or 2-inch incision. By doing this, you will have a very natural look in her breast. The second procedure is going to be a facelift. Although she is young, she is already starting to age and show her age in her face. We're going to do some liposuction, remove some fat from under the chin, and then we're going to remove the excess skin by a small incision that goes into the hairline here. Then it goes behind the cartilage of the ear, turns around, goes behind the ear, and then goes into the hairline. And apart from the facelift, she also needs some blepharoplasty, which is eyelid surgery. And we're going to do that removing skin and fat from the upper and lower eyelid. The third procedure, which is a mid-sized procedure, will be a rhinoplasty. She has a big nose for her features. She's a small person and has a very big nose. So we're going to reduce the nose in size and also make it a little bit more tilted up. She has a little bit of wrinkles on the forehead, and instead of doing a whole temporal lift, we're just going to put some Botox, which is a temporary paralyzing injection for the muscles. The muscles will be smooth on the forehead for at least 3 to 6 months. Also, to balance her profile, although her nose is big and we're going to reduce the size of the small, she also needs an augmentation of the chin. So we're going to put some chin gel and augment the size to have a very nice profile.
شكبط شخبيط لذيذ بالدكتور توليدو، ابتسامته انه هيك بيطمن بفائل يعني. ان شاء الله خير. ضرورية هالفقرة؟ ضرورية هالفقرة؟ بلاها.
ضيفي الثاني بالاستوديو الليلة بلاستيك سيرجن البرازيليان دكتور توليدو. Good evening, Dr. Toledo.
Good evening.
How are you?
Very well, and you?
You have done many contestants for us this year, and what you've done on Amal is a lot of work. You've got to let us know what you did exactly, and how was the procedure, and how did it go?
Well, Amal needed at least a couple of procedures, and so we didn't want to stay with her on the operating table for too long. So what we did was to break into 2 times. And the first time we did the face and the nose, and the second time the breasts. We did augment the breasts to make it more proportional to her figure. She had very small breasts. And on the face, although she is young, she was looking a little bit tired, and she had a little bit of excess skin on her face. So we did a rigidoplasty, which is the facelift, and also eyelids, and improved her nose a little bit. She wanted to keep her ethnic nose, and we just made it smaller for her a little bit.
I have to say, I know what you like and what you don't like, and I think you don't like noses to be too small.
Yeah.
That's been something you've tried to convince a lot of the contestants not to go too small, to keep with the shape of the face.
Yes, the problem is not being too small. Some people need small noses because they are proportional to their faces. But if a person has a nice face or a bigger face, you cannot put a nose that is not proportional. And the beauty is in proportion. This Leonardo da Vinci already talked about this. You know that beauty is proportion.
That's right. You're very right. Dr. Toledo, let's talk a little bit about just all the operations in general. A lot of people think an operation is more like going shopping these days, and they're very surprised when they are going through a lot of pain and they go through a little bit of depression afterwards. But that's quite normal, right?
Well, every surgery involves risk. So what we have to do as plastic surgeons is to weigh the risk with the benefits that we're going to bring to the patient. And if the benefits are bigger than the risks, then we should go and do it. You should not go to plastic surgery as you go shopping for shoes. It's not the same thing. You have to be very fit physically to undergo plastic surgery, and we have to do all the exams before to make sure that this is going to be very safe. And safety is the most important thing in plastic surgery.
That's right. I do know we had 2 contestants on the show that you refused to do surgery for them because they were not fit and healthy
enough. Yes.
The other thing, Dr. Toledo, I'd like to discuss that the expectation from plastic surgery. Some people feel or think that the results will be, how can I say, like so perfect, and they have an image in mind that's not always what they get at the end, but what they get is beautiful.
I'm still thinking. I'm still thinking to learn how to walk on water and to have a magic wand, but we still don't have that. So we have to work with the things that we have, which is technique and surgical instruments. And that is something that sometimes it's unpredictable. And you have to go through the whole process of healing, and that sometimes takes more time that the patient is prepared to wait for.
That's right, because even with Amal now, we're going to see Amal in the final look, but Amal is still going through some healing, right?
Of course.
It's going to take a while, a few more months until we see the final result.
Noses, for instance, you have 80% of the swelling goes down after 1 month, 90% after 2 months. And normally for most surgeries, after 6 months you have a final result like liposuction, breasts, even a facelift. But noses, sometimes they can take up to 1 year, sometimes 1.5 years to get rid of all the swelling. So, and it's something that we have to wait for that.
Dr. Toledo, I'd like to thank you very, very much, not just for the work that you've done on Amal, but all our other contestants, because they are all very pleased with the work, and so are we, of course. Thank you very, very much, and I'd like to see you with us again.
Thank you.
I'm sure next time I'll have more questions.
All right.
أمل هلا جهزت واقفة حدة، وأول ما وصلت على الاستوديو اليوم بلشوا الدموع يكرف، أنا هلا مهددتها إنه ما لازم تبكي حتى ما تغير ما تنزع مكياجها. أمل جاهزة؟ ما بدي أشوف دموع. بدك حتبكيني معك، يلا.
واو هيدا أنا؟ كثير حلو. مكياج كثير حلو. والشعر والفستان.
شو رأيك هلا لما شفتي حالك؟
كثير حلو، يسلم ايديكم ويعطيكم العافية. كثير حلو. شو بدي اقول لك، ما بعرف.
بدي اقول لك كونجراتيوليشنز كثير كبيرة،
ميرسي.
وبدي تضلك على هذا النمط.
ان شاء الله. ميرسي.